Now to the mayor's extraordinary action of declaring a state of emergency. He and County Judge Nelson Wolf have both been critical of the federal government's handling of the coronavirus evacuees at Lackland Air Force Base. This afternoon, the mayor announced the city of San Antonio will assume control over the spread of the virus. Eyewitness News reporter Jeremy Baker joins us live with what this means. Jeremy?
Yeah, well, Deborah, because of what the mayor is essentially calling a failure on the part of state and federal governments to step in and keep San Antonio safe, local health officials are stepping in to make sure San Antonio residents are kept safe and the threat of exposure is minimized. North Star Mall will be closed for the next 24 hours or so while they do a deep cleaning. That was a recommendation by Metro Health. Metro Health and the mayor's office held a joint press conference earlier today. Take a listen to see what Mayor Nierenberg had to say.
As mayor of this city, I find it totally unacceptable that CDC would release a patient prior to receiving all test results and potentially expose the public to this harm.
Earlier this afternoon, Mayor Nierenberg issued that declaration of public health emergency, which activates the City of San Antonio Emergency Management Plan. It says this declaration authorizes the city to commandeer or use any private property, temporarily acquire by lease or other means, sites required for temporary housing units or emergency shelters for evacuees, subject to compensation requirements. Also, this declaration authorizes the city to take any actions necessary to promote health and suppress disease, including quarantine, examining and regulating hospitals, regulating ingress and egress from the city, and fining those who do not comply with the city's rules. Ingress into and travel through the city of San Antonio from Lackland by those persons that have been quarantined in the facility is not permitted. No previously quarantined person shall be permitted to enter the city of San Antonio until further notice. This declaration will be continued for at least 7 days unless it is renewed by the city or continued, and we'll have more coming up at 5 o'clock. Live by North Star Mall, Jeremy Baker, KENS 5 Eyewitness News.
All right, Jeremy, thank you. Well, as we learn more about where the released coronavirus patient was in the city on Saturday, people are concerned about the health of San Antonians. Joining us now is internal medicine specialist Dr. Fred Campbell from UT Health San Antonio. Dr. Campbell, thanks for being here.
Thank you.
We know this patient was exposed to the public for at least 2 hours at North Star Mall, at the food court, and 3 separate stores. What should people do who may have come into contact with this person do?
Well, fortunately, from what I know about the patient, it appears that the patient was at very low risk of transmitting the COVID-19 or coronavirus to the public. It's usually a symptomatic patient with coughing in particular or sneezing and other symptoms like fever that is most likely to transmit the virus. Now, that doesn't mean that patients that don't have symptoms couldn't transmit the virus if they've been infected, but it's much harder for that kind of individual to become a risk.
So what kinds of symptoms should people be watching out for?
Any respiratory infection these days that involves a fever or a breathing difficulty or both should be an indication to consider a medical evaluation.
And where do people go to be tested for possible coronavirus?
It's very important that people choose a good source for testing. The CDC has specific test kits for the COVID-19 virus. Other tests may just pick up coronavirus, which is a very common cold virus, and cause unnecessary alarm. But usually hospitals, particularly the University Hospital and other hospitals in the community that are in close contact with the CDC will be getting these test kits and be able to make firm diagnoses.
Do they have the test kits yet?
Believe if they don't have them yet, they're in transit. So it's an imminent probably thing to expect those kinds of diagnostic kits to be here.
Now, is there any danger of touching surfaces that a person with active coronavirus may have touched?
Yes, the most important way to avoid contracting is to avoid people who are coughing or sneezing. That's the most common way of contracting the virus, but the virus on surfaces can survive for short periods of time. So cleaning surfaces and avoiding touching the face and mouth with a hand that could be contaminated is very important. Hand washing, of course, is the ultimate in protection and just avoiding sick people.
All right. Okay, Dr. Campbell, thank you so much for joining us.
Sure.